All right, it's Thursday. We want to welcome you back into Coronavirus Inside the Arizona Numbers. Our daily chat with all of you is back. We got past election season. That took a lot of our data focus, if you will. Garrett, surviving it. You're back at home. I'm here in the station today. We want to continue our focus as we have had all summer long, all year long, helping you understand the data as it comes out from the state of Arizona related to coronavirus so you can make the best choices for yourself and your family. We'll have a little bit more time now that we're back posting daily with you to answer your questions in the comments. So if there's things you're looking for or data you're interested in, we'll have a little more time now that we're here daily instead of just weekly. So welcome back to you, Garrett.
Thank you.
We should start where we always do with the daily numbers. And with that said, I know so many people are getting emails and communications from their school districts right now. I have been in touch with my kids' school districts. Some changes are happening. So we're going to dive into those numbers too. We'll get to your zip codes and we'll look at all that because, of course, it is Thursday. So, Garrett, we'll start where we always do on that dashboard from the Department of Health.
We are. So today, actually, if you've been following along with the numbers this last week, I know this is our first sort of going back to the daily, but we've had some pretty high numbers for most of this week. Today's number, 1399, still over 1,000 as we have been for quite some time, though lower than the last couple days. But I would really attribute that to Veterans Day at this point and having some of the county health departments not being open. If you recall, last week, 2 days ago on the 10th, ACHS reported 3,400 cases in one day, which is one of our highest reports since July. And then today, the numbers are a little lower. And again, I have a feeling because of Veterans Day and that as when the numbers get released tomorrow, we'll see higher numbers. Death numbers, 12. Again, a lower number. Possibly because of Veterans Day, our numbers per deaths have been increasing a little bit from the last several weeks, and we'll keep watching that. The number of tests released today, 15,000, with the number of serology tests being 1,000. So interesting about the tests that we have to go over. We're now getting to the point where our testing numbers that are being released are now where we were at the very beginning of the peak, or excuse me, the very end of the peak. This is actually our testing average is now at the third highest it's ever been. And this is sort of a silver lining in all of this, because now, you know, when we prior to this, when we were in our first peak, we had no idea what was going on until about 2 weeks afterwards. That's when we got to the peak. It seems like nowadays we're only about 3 or 4 days behind, and which is as good as we're going to get. We're only going to get 3 or 4 days behind. We're never going to be like the next day. We know exactly what went on the day prior. It's always going to be about 3 days. And so the good thing is that testing is ramping up. There is no lag in testing. There's no lines right now. There's a lot more testing going on, but we're not sitting here, you know, we're not getting complaints from people saying, oh, I haven't gotten my test in 10 days, 15 days. Of course, there's going to be some of that, but it's not going to be pervasive at this point, where most people are getting their tests back within 2 to 4 days or so. So this is sort of the silver lining in where we are right now as far as being able to detect what's happening out there.
Yeah, there was sort of an evolution in testing, if you will. We sort of saw at first not enough tests, and then the result capacity was coming back slower. There was some testing agents or some sort of something that they had in the testing that they couldn't get access to. So it was like each little step along the way had its problems, had its difficulties, work through those. And now, yeah, you can get a test. So if you're interested in getting a test, here's where you can go to the AZDHS site. They've got a full list. You can choose either saliva tests or the standard nasal test that we've been telling you about. A lot more testing sites set up in a lot different areas, stretched out all over the state. They've done a good job of spreading those out. So, I mean, we have testing sites right up along the border with Utah, the border to California. We've got them everywhere. So you're able to go on there, find some more information about where to get tested and how to do that smoothly and easily. So that's the place you should go to find the complete list of testing sites. By the way, when you do these tests that are listed there, they should be free. So like if you do the saliva test through ASU, that is a free test. I've heard of some people have posted on my page, well, I don't want to pay to go get tested. That should never be a barrier in all this. If you can't find a place, reach out to us. We'll let you know where you can go.
I had to get tested this week, and I went to a random Banner urgent care around my house, and when I went up at the end to pay, she's like, nope, you're fine. And I just walked out. So
Yep.
same exact thing.
And I didn't know if you were going to share here today, Garrett. So thank you for sharing. And I just got tested this morning. So a lot of us were covering the election, and there were a lot more of us together. So as a precaution to our coworkers, and out of an abundance of caution, many of us have gone to get tested. So I was there this morning. And how quickly did you get your results then, Garrett?
I got my results back today, and I took it on. So it was 3 days. 3 days.
3 days. Okay.
Yeah.
So people are hearing back pretty quick. So that's the good news in all this. And again, thank you for sharing. So, okay.
Yeah,
so
I took that PCR test, the one with the nasal swab, and just now I've been watching this for months now, and now I sympathize with anybody who's gotten that test. That is not a pleasant test to get.
Yeah, that's why I'm always doing the saliva test for ASU. That's a lot easier, I think. I'll drive farther just to get that one. Okay, how does Maricopa County look when we compare to the state as a whole? Just to remind people, it's more than half of the population. It's our most populous county in Arizona, and that's why we always look a little closer at those numbers.
So Maricopa County is about, as you can see, the deaths that were reported today came from Maricopa County. That's the 12 deaths, and it's right there as far as you click on it. And they are pretty much the more than half the cases today, a little less than half the cases actually for the number of cases reported, but all of the deaths reported today. This is pretty typical for Maricopa County. We do find we have extremely high positivity rates in the rural counties right now, and so you're going to see a good amount of cases coming from those areas. Maricopa County actually has one of the lower positivity rates in the state right now, which is it typically does. It does. I don't want to say it does. It has a very stable positivity rate, but right now the rural counties have so high rates. I mean, we're talking double digits for most of them. That Maricopa's is actually quite low comparatively.
All right. So we want to remind everybody, this is on the summary page of AZDHS site. It comes out each morning, and we always start there just because it's a broad overview of how things kind of look on the day as we track this. Now, across the nation, 1 in every 378 Americans tested positive this week. So just to put that in perspective with our numbers here in Arizona and what they're seeing around the United States, again, 1 in every 378 Americans tested positive this week alone. All right. So Garrett, as we're looking at some of this on Thursdays, as we've noted before, it's always a big day for the schools. And I bring that up a little bit early in our conversation today, just because people are starting to chat with their schools and hear from their schools on how things are looking. And those numbers are increasing. The map looks a lot different than it did just a few weeks ago. What should we know about the how dated, I guess is what I'm asking, is the information on the school's dashboard that's coming out from Maricopa County?
The school's dashboard map, which, like you said, we will get to, is that's only a week old. So it was actually a little newer than the AZDHS data. The AZDHS data is about 2 weeks old. Mm-hmm. This one's only a week old. So we're looking at much more recent data with it. And because tests are coming in at such a better rate now, they're more accurate. We can look at last week and be like, okay, these numbers are stable at this point. And that's the good thing about the Maricopa County dashboard, is it's a week ahead of the AZDHS, but still stable because of how quickly the tests are coming in right now.
Yeah, so it's one of the important caveats in all this to know how what information has stabilized out in this. For instance, when we look at the collection dates and the dates of death as they start to fill those numbers in, it's important to know how much of the most recent information is actually solid and what they're waiting to fill in on some of those. As we always remind everybody, we start to see cases, then we see hospitalizations, and then sadly, in some cases, if people don't survive, we see deaths. So that's why those numbers don't all happen all at once. I've gotten a ton of questions on that just within the last 24 hours as we're starting to
I'll bring up those graphs right now to show everyone what you're talking about. I know we haven't done this one in a while, but I'll show you my internal charts that I use for the newsroom. And as soon as it renders here, come on. And it shows exactly that. It shows how everything is sort of, the lag is much less, and deaths are not increasing at the same rate as cases and tests are at the moment. Although, as you say, there definitely is a lag in this data. So let me bring it up. I'm bringing it up right now. Here we are right there. Okay, so I brought it up. This is what the case epi curve looks like. You can see this is where we're at the peak. We're only at about I mean, we're at about 2,000 cases a day right now. At the peak, we are about over 4,000 cases a day. So we're still less than half where we are right now. We do have a slight decrease in the rate of growth in the last week, last day or so. But again, I attribute that right now to Veterans Day, so that might change going forward. But you can see not a lot of light blue. It's really hard to see, but very little light blue. And almost all the light blue is right here up front, which means all of our data is recent. So, and here's the testing graph, and this is different. Now you can see that while our testing, our case numbers are about half where we were at the peak, we are now basically coming to a second peak in testing. This average line is now essentially where the average line was at the very peak of testing. Don't know where it's going to go quite yet, but it's definitely meeting where we were in June and July. And then to follow up as the final, this is the death line. And you can see this is what we were talking about. You just saw some very aggressive increases in the cases and the test numbers. And when we look at these death increases, you can see, well, there is an increase in deaths. It is quite gradual compared to everything else. So what the scary thing is, as Katie mentioned, is that we don't know how bad the lag is here, and if this is going to be a situation in which we start to see a dramatic increase, or if this continues to be a gradual increase. We just don't know yet. We're not going to know for a couple weeks.
Yeah, we're seeing Sarah's comment there. Sarah, our thoughts are with your family as you try to recover from this. That's what I hear from folks, is that it just really, you have not experienced fatigue like you have from this, that it is just overwhelming. And you're so welcome. I just saw that comment, Kathy. Really appreciate this information. Thank you. You're so welcome. That's why we're committed to making sure everybody gets this information to understand the numbers even better. And Garrett, you were talking about the cases, the hospitalizations, and then sadly, eventual deaths. We know a little bit more about these case numbers specific to Arizona. And I want to stress this because I know we have a lot of people watching from all over the country, and hopefully you're able to find this information in your neighborhood as well. But we can tell here in Maricopa County that anywhere from 11% to 8% are ending up in the hospital after diagnosis. That's something that can be found on the Maricopa County Health Department's website. It fluctuates just a bit. That's why I say from 8% to 11. But a lot of people will dismiss the number of cases, if you will. That's not a metric that they watch closely, but they watch the hospitalizations a bit more because they feel like that's the number of people whose cases are more severe, more concerning, more financially detrimental. So I believe that's still at about 8%.
Yeah, I'm here. We can look at it right now.
Perfect.
So I'm looking at this is the hospitalization graph. You can see the hospitalizations have come in at a much lower pace than they did back in June and July. I mean, we're still pretty much only 10 or 20% higher than we were at our lowest in September in that category. As far as hospitalizations, we are at 8% right now. It is a lower number, as you said. Sometimes it goes from 8 to 11%. Right now, it's about 8%. And then, and I will get to the zip codes, Misty. I see Misty's asking for zip codes, and I will get there.
We will go through all of them.
Yes, we absolutely will. And then, and so you can see this is this number here. This doesn't really change. This ICU number is about where that is, always has been around that 1% level. We'll just take you through these really quick since we're already here. Age groups, you can see, obviously, the vast majority of deaths are coming from 65 plus. Hospitalizations, very few numbers in the 0 to 19 category. A little more hospitalizations than 2044, but the death numbers are still very low for those groups. And that sort of translates all the way until you get to that 65 plus, when the mortality rate sort of increases. And then, we won't go on that one right now. We will go to this one. This hasn't really changed. This is sort of the population, the what it looks like. And these numbers have stayed very constant for several months now. This is where we're talking about the 83% of the people who have died from COVID-19 are in the highest risk category, which means they were either over 65 or they have a chronic medical condition. And you can see that you have to put a line between these. These two are not mutually. These two are mutually exclusive, so you can't look at those together and it mean anything. But this is basically showing what the population of Maricopa County, the one that got hit the most. This is what's showing what that looks like. Care facilities. This is our long-term care facilities in Maricopa County. You can see about 1,333 residents. have been hospitalized. 1,265 have died. That's about 30% of the people that get COVID-19 in a long-term care facility die from it, which is pretty incredible if you think about it. And then finally, the schools. And I would recommend checking this if you have people in school in Maricopa County. I would recommend checking this on a regular basis. This shows you the number of schools that have COVID-19 outbreaks. These two numbers are open, closed. So like today, for example, I saw a lot of these. Let's just say this number shifted to this number. So several schools closed and shifted the number of cases to here. And then your students, 213 students in Maricopa County and 74 staff members have gotten COVID-19, contracted COVID-19.
So we're so lucky to get this information from Maricopa County. Some of the other counties are pretty transparent. You'll have to look at each specific county to see what information they provide. But we use Maricopa just because it's the most populous and because this information is so easy to read on there. So that's where you can find this, right on the Maricopa County Health Department's website. All right, Garrett. So this is not just an Arizona thing right now. We're seeing 27 states move into a record-breaking category of their cases reported just this week. One of the places that we've shown people for weeks and weeks has been the RDOT, the RT live site. Another one that's really easy to read. But what I noticed when I looked at it this morning, for a long time, it's been half and half green, half red. Mm-hmm. When we show this to everybody, it's going to be pretty shocking. Only one state in the green.
Yes, and Mississippi is the only state that's in the green. Every other state, and that to me almost suggests a reporting issue, right, because they are so different, and it's very rare to see. And anybody who's been following us for a long time knows it's very rare to see that much of a difference between two states. They usually sort of follow this pattern where they're all around the same detection, and then there might be some increases, but it's very rare to see that. So I'm not sure what's going on with Mississippi, but just the data analyst in me says that that's probably a reporting issue.
Yeah, especially coming off a holiday when it's updated each day. One thing about this site for anybody that's new, it is updated each day. It was just updated this morning at about 9 a.m. That's pretty typical. And if you're asking yourself, what is RT, what is R naught? It is up-to-date values for the R naught that are tracked on this page. So it would be a key measure of how fast the virus is growing in your particular community. This is broken down by state. So that's the average number of people who become infected by an infectious person. When you see it above 1, the virus is spreading quickly. When it's below 1, the virus will slow in spreading. So that was why it was so key for Arizona to get under 1. We did achieve that. And then as we can see, we're right back out of that category at 1.18, along with most.
Yeah, and so basically what this is telling us is that, with a 1.18, as we've said, 100 people who have COVID-19 can pass it to 118 people. So obviously that means that, in a certain amount of time, about 5 weeks or so, our case numbers should double from where this number is right now. That's what you're looking at. If it was at an RT is 2, it doubles essentially every day. So right now it's doubling. It doubles for every. I think this is a weekly estimate. So every 5 weeks. Every 5 weeks, I think, is what this is trying to say.
And boy, look at Maine at the end of the chart there.
Yeah, and you can see Maine right here at the top being at 1.5. And so this is and I have to say it's been over 1.1 for about 2 weeks now, I believe. So and I would agree with this metric more nowadays than I used to, because we were so behind in our testing and our cases that it was hard to sort of pin down this metric. But now that we're getting 2 to 3, only 2 to 3 days, you're getting your test back. That this is a much better representation of what's actually going on out there. So I think 1.18 is probably correct. I think Brent wanted Iowa. Iowa's at 1.23. So there you are, Brent. It's at 1.23. It's a little higher than Arizona right now.
Yeah, and Brent, although we always stay on the Arizona numbers, of course, one of the concerns is the Dakotas right now, and you being right next door. Sioux Falls just voted down a mask mandate for their city. That was very concerning. The vote was 4-4 in the council there, and then the governor, or the mayor of Sioux Falls, had the final vote and voted down because he didn't want to see, he said, more divisiveness in his community. But the big concern is that all of the ICU is full in South Dakota. So one of the big concerns there, state by state, we sort of highlight what has happened, but and we'll continue to talk about Arizona, but just very, very concerning there. Even Dr. Burke said of North Dakota that in Bismarck, she was seeing hardly anyone. It was the least masked city that she saw. She had said just a couple of weeks ago. So one of the concerning factors in all of this. Okay, let's talk about our hospitalization numbers, Garrett. How much room do we have in the hospitals here? How much room do we have in the ICU?
So we have, let me go to there. 1 second. Okay, so on our hospitalizations, we'll just start with the ICU because that's where we land on. You can see we have about 14% headroom in there of unused ICU. And so that comes about, what, 86% of our hospitals, our ICU rooms are occupied right now. And about 20% are from COVID-19 patients. You can see that obviously that's nowhere near at the very top, which was around 57% of the ICU patients were COVID-19 patients. As you can see, what the hospitals try to do is they sort of try to keep that ICU occupancy at around 80%. This is to make sure that the hospital remains, people need to get their surgeries, and that the hospital remains cost effective, as much as possible. And so they try to keep it around 80%. We're at about 86% right now, with about 20% being COVID-19. Inpatient, which is general acute care, 16% of the hospitalizations are from COVID-19. We have about 88% of the hospital of inpatient beds are full. That gives us, let's see, that's getting close to where we were at the very, very top. So that's something to sort of consider. We are sort of at a peak of where we were in inpatient, even though, in this case, 40 to 45% of the beds were from COVID-19 and only 20%. We're still pretty much at the same amount of headroom we were back in the peak for inpatient. This is the emergency room, fairly consistent. As you can see, it's about 40 to 50% and this is just, it said this is just people who go to the emergency room visits. This isn't technically COVID-19 quite yet. When we go to our hospital-specific metrics, that's when we can see COVID-19. This is a little way to break out the curve so you can see a little better. You can see for the inpatient numbers, this is where our lows were in late September. And, we had a gradual increase, and now we have an accelerated increase that sort of started on November 1st. Ventilators, you can see sort of a gradual increase in what could possibly be an accelerated increase that started on November 11th. And then ICU, it looks like we've had an accelerated increase pretty much November 1st on. As you can see, this number has just really started to go up pretty quickly. These numbers I'll just go through really quick. Our discharge, obviously we have more COVID-19 patients in the hospitals, so our discharge rate is going up. That's what this is. COVID-19 emergency room visits also have gone up, and we've seen that in the COVID-like illness surveillance information. And then the intubations performed, we had a very high one a couple days ago, one of our highest, and then it's kind of dropped down again. So just some things to think about. Those intubations are going up.
Yeah. All of those numbers going up, pretty concerning.
Yeah, everything's going up, yeah.
Lindsay's comment, I'm 5 months post-COVID, considered one of the long haulers. I was healthy, an active mom of 3, and now she's talking about all the things she's experiencing because of this. So Lindsay, thanks for sharing what you're going through. We hope you feel better very soon. One of the words used in there that you may or may not have heard, long haulers, those are people who have passed the likely recovery date, that they're still experiencing symptoms for a long time in this. And Garrett, it's one of the outliers that you consider when trying to sort of figure out how many people have are not actively infected anymore. It's a tough word to describe because recovery is a difficult definition to find. And so a lot of places are shying away from the word recovery, instead looking at active cases. In the way, since we don't have that number publicly given out, you've sort of figured out a way to get to that number, if you will. You take the 267,000 cases that we have here in Arizona, the positive the cases since the pandemic began, subtract out from that, sadly subtract the deaths, and then you look at the collection date, the diagnosis
The data
date.
collection, yeah.
Yeah, and drop those off if they're over a certain age. I've watched your numbers throughout these past few weeks, and I can't believe how quickly they've climbed.
They climb very quickly.
They've
When
not
the case
doubled.
numbers are, yeah,
Yeah.
they are doubled now. Yeah, they're essentially doubled at this point.
So what range are you looking at now? If somebody's saying 267,000, what number of that is active, do you believe?
Today, I have an estimate of 26,000 at the low end and 42,000 at the high end.
Wow. Yeah, so it's definitely doubled.
The 26,000 those are definitely infectious confirmed cases. The 42,000, anything above that, is possibly infectious confirmed cases, but likely less so. So really, that 26,000, that's those 14 days. I mean, you got your test positive. You had it within 3 days, and then that's 14 days of having COVID-19. And I know that young people don't have it less than that, but that's why that number is going to be a little bit better. About 30,000 people walking around Arizona with an active infection, essentially.
Yeah.
Active confirmed infection. Let me add.
Right. There's some people
who have not tested positive.
Yes. Okay, so we are going to run out of time to get to the schools. So do you need to take a sip of water before we start going through some of these zip codes and school districts? I do want to let you know a couple of school districts, after hearing today's numbers, are moving to, they're shutting down, moving back to remote. So Creighton School District is moving back to remote learning effective tomorrow. They just decided this after their numbers came out a few hours ago. They are moving to remote learning effective tomorrow. They will stay that way till they go back after the winter break. It's something that we could see mirrored in other school districts. So I know many school leaders have said, prepare for a backup plan if you're a parent. This is the final wake up call for this, that it is happening in school districts in our area. So, and also Casa Grande Elementary School District also going to remote learning until January. So wanted to update you on those, and then we will see that reflected in the numbers. As I always remind people, the school dashboard chart comes out every Thursday. They've been updating it a little bit earlier in the morning, and now that we're back to daily, we'll update it every Thursday for you. You can look at this anytime with the site that you're seeing on the bottom, but Garrett can provide a little more perspective on what these numbers mean. And as I, again, always remind people, look at your zip code and then at each of the school districts in your area, because you can find a little bit different information based on how your zip code and school district are configured. I always use myself as an example. My zip code goes one direction, my school district goes another direction, and just a bit overlaps. So it's worth, at my house, to look at both numbers. It might be the same for you. So that's why I always encourage that. So I'm seeing an awful lot of red on that city map right there.
Yeah, there's a lot of red on the city map, and really some of these are going to be red on Thursday and join everybody else. So as you can see, definitely community spread in Maricopa County. The entire East Valley has turned to substantial. Phoenix, Scottsdale is already in substantial. As you can see, the only reason it's yellow is because it was quite literally just on the cusp last week at 99.97. Fountain Hills, less so. It looks like Fountain Hills is probably going to stay yellow next week. And then some of these very northern rural towns up here, Cave Creek, Carefree, might stay yellow. But essentially, we're looking at the possibility of everything on this map essentially everything being red by next Thursday. We'll see what changes.
Yeah, and Garrett, as you're mentioning that, we're getting another school in that is closing down. So this is going to be kind of rapid this afternoon. Glendale High School has just announced that they are returning to remote learning. They're going to be doing the same thing, staying home through the end of the semester. So that just coming into the newsroom moments ago, and you're seeing that all reflected on the map.
So we'll move to those. We'll get to Glendale. We're going to go to the Unified School District first. You can see all of the East Valley Unified School Districts are in substantial, and also Scottsdale Unified is in substantial, as well as Deer Valley is now. And someone's asking specifically for Deer Valley, so you can see just over that case per 100, 114% cases with a 7% positivity. And then also Dysart is now in the substantial at 102. Some of these others, very close. Cave Creek, very close to substantial. Paradise Valley is this week in substantial, but it's not considered substantial because last week it only had a 78. And then Saddle Mountain Unified, actually quite low. This is definitely not something that's reached the exurbs yet. They only have a 28%, or excuse me, 28 cases per 100 with a less than 1% positivity rate. So very low numbers in that district. Let's go to the high school districts. This one, as you can see, basically all of the southwest of Phoenix is being impacted by this. Phoenix Union is in the red at 135. Tolleson at 174, essentially 11% positivity rate there in Tolleson. Agua Fria 151, very high number. And then this one right here, Buckeye 155. So essentially all of the high school districts save Tempe Union, which is in the red this week, but wasn't last week. So that's why it's considered still yellow, but it's going to be red next week. And same thing with Glendale Union High School District. It's going to be red next week. And that's probably why we're looking at them changing, because they saw that they're basically red from this last week, and so they're going to be reconverted to red on Thursday anyway.
Yeah, I mean, when you see the cases going up this fast and
Yes.
and you see the last week unread, there's no reason to believe it wouldn't be reflected in that the very same way. Kristen was just asking a moment ago, when are some of these schools closing down? Some are closing down effective immediately. I know Creighton is closing down effective immediately. I'll have to see about some of the others if it's starting on Monday for you. But this is happening now. So these families that didn't have backup plans are really in a scramble this evening.
Yes, absolutely. And you can see now we're at the elementary school districts. Essentially, all of the elementary school districts in the southeast or southwest, excuse me,
Red.
are in the red, with some very few exceptions. Washington Elementary School, and that's actually triple digits in its case per 100. It's just only 1 week at that. And Madison Elementary, also triple digits, just only 1 week. So it's going to be recalculated into red next Thursday. Same with Tempe. And then this is Balls, and it is also the same. So basically, this entire area right here, it says yellow right now, but it's going to recalculate to red next week. So this entire area will be red on Thursday.
So to remind people, if red is the metric for your particular school district to close down, you're going to want to click through, just because you see yellow on the front of the chart here, to click through and see this little pull-up box that shows, and scroll down, because if it's red in that category but still showing up yellow on the screen, it's kind of what Garrett and I have dubbed an orange category, meaning you will likely be in red next week.
Correct. Absolutely. And then we're going to go to zip codes. This is the one that everybody wants to see, of course, because it gets a better idea of what's happening in the community. And this sort of follows what we just saw. You can see tremendous amount of increase in the East Valley, almost every zip code in the East Valley and the West Valley and the Southwest Valley, and also the North here. So the very interesting sort of, you can see there's this swath down the middle of Phoenix where it's still sort of in moderate. But really, it's the sort of the east and the west right here that are getting impacted the most right now. So let's do a couple of these. 85051. This one is still technically moderate, but not really so. It's already at a 131 and a 12.4 positivity rate. So that one's going to turn red next week. 5202. This one is red. 145 and 133 last week. With a sort of a 6.1 positivity rate. 85257. This one, wait, did I say? Yeah, Scottsdale. Okay. Yeah, this one is still yellow, but barely so. It's got a 97 for this next week, so it could next week convert to
back to that. It looks like it was there, but just by grace of 3 cases made it into the yellow.
And then this is Mesa, 85204, 122 cases per 100. And this is a slight decrease from last week, but only slight. And then let's see, 85015. 85015 is the only moderate in this area. And this one's at a 97. It's barely moderate. It's just 97.3 with a 7% positivity rate. 85338. 85338 right here, 177 cases per 100. That is an increase with a 7% positivity rate. So let's see, 85295. 85295. This is a 163. Then we're in Gilbert right here. This is Southern Gilbert. So you can see how this is really going everywhere nowadays. If you remember, we've been covering this for a long time. And the East Valley was certainly doing a lot better than Central Phoenix at one point. But now we've got really high numbers in the East Valley as well. 163 from 133. So an increase week over week for 85295. So 85041 is red, but barely, 106, with a positivity rate of 11%, and that is a decrease from the week prior. 296, that sounds like a Gilbert zip code. It is 159, slight decrease, but still in the red. Let's see, 85207. 85207, this is Mesa, and it is not in the red, but it's in the red for this week. You can see a 130 right there. Let's see, 85085. This is Union Hills, and it is 105. So it's 2 weeks in substantial, slight increase week over week. Let's see, 85345. I don't think I'll have an 857. I don't know where that is, but that doesn't sound right.
Yeah, so just to remind everybody, we're lucky enough to get these numbers from Maricopa County. We don't get them from other counties. So if they're within Maricopa County, we'll be able to update you on it.
This one's barely yellow, slight increase. This is 85050 from 79 to 98, but still slightly in the moderate. 85215. 85215 is right here, and Mesa, 123, slight decrease from the week before, but still in the substantial range. 85635. I didn't think I would have that one either. 85335. 85335 is El Mirage, slight increase from 112 to 137 with an 8% positivity rate. 85374. Let's put that right now. Okay. Right next to her. And this is Sun City. You can see still not, or Surprise, but near Sun City. And this one actually has a fairly low positivity rate for what we're seeing all around the place, 77 to 66. So that's good. It hasn't reached that area yet. So we're still seeing low numbers there. 85022. Moderate again from 74 to 80, though increasing, but on the lower end of the, again, putting it into perspective of where things are right now. 85383, Peoria, 143. So this is it's gone from 100 to 143 for this week. So pretty big jump. 85383. Nope, I think I just looked at that one tonight. 85033. This is substantial. Ooh, 15% positivity rate, 134. So that's pretty big number there. For positivity rate in the case per 100. So let's see. 85258. 85258 in Scottsdale. 136 to a 113. A slight decrease in that zip code for the week. 85323. 85323. This is Avondale. Slight decrease from 189 to 143 with a slight decrease in the rate as well. Let's see. 85053. Still red, of course. 85053. 132 with a 10% positivity rate. So that's a pretty high number. Anything over 10% positivity rate is obviously quite a high number. So
yeah, quite concerning. Speaking of the numbers on there, Garrett, when people are seeing that bottom number, they're seeing it pop up the same everywhere. That is CLI. Yeah. That is COVID-like illness in our community. Those numbers are updated everywhere on Sunday. So that's the date that you'll see that change. We've seen that sort of steadily increase from about, I think it was 2% at the lowest. Yeah. And now it's at the high end of 4%.
Mm-hmm. Yeah, and it could, that's one of the things to watch as we watch the emergency room numbers to see if they go any higher, because that's going to affect the CLI, of course.
Yeah.
85255 from a 131 to a 126. So it's a slight decrease, but really marginal. 85122, I do not have that. I'm sorry, that's Pinal County. 85042. And it's not my choice. Maricopa is the only one that gives us this. So 85042, 95, actually slight decrease from 120 to 95 for 85042. 85345. 85345 is from 72 to 116 with an 8% positivity rate. So let's keep going for a little longer. We have a couple more minutes, right?
We do have just a few more minutes, and then we'll have to remind everybody where to find this.
All right. 85138. Well, I'm sure we're going to be going over this a lot in the next couple of weeks. So, because we're going back to dailies on this, so people will be able to come. So this one, 85014, marginal increase, but only marginal from a 95 to a 99. Not a lot of changes there. So we'll stop for the day on here. But again, I'm sure we're going to be coming back to this.
Yeah. So this is the address on where you can find this, and the numbers are only provided from Maricopa County for the school's dashboard. It's updated each Thursday. That's why we spend a disproportionate amount of time on Thursday on it, just to get you all updated. If you are in communication with your school district, you're hearing that they're closing down, let us know. We're quickly compiling a list as things are changing rapidly this afternoon. If your school district is not making changes, please watch it very closely next Thursday. Make sure you have a backup plan so your family's not caught trying to figure out how to maneuver this. If it does, then react quickly next Thursday. So we're seeing some families sort of scrambling tonight.
And just for people who are in Pima County as well, I'm just putting this up so people can see this, and we'll put it in the links too. I'm not going to go through these right now, but Pima County has a fantastic dashboard as well. And we're just in Maricopa County, so we spend a lot more time. But if you're in Pima County, this is a great dashboard. It goes all the way down, same exact thing, school districts. In fact, this one actually goes all the way down to the census tract level, which is something that Maricopa County doesn't do, where you can really, really drill down to quite literally the neighborhood. So Pima County has a fantastic dashboard too. So just wanted to give a shout out to them for that. As they've done a fantastic job with that one as well.
Yeah, we've added it right now in the chat so everybody can find it. Micah was asking, are you going to be doing this more than once a week? To answer your question, Micah, yes, we are back with you. We had to pause just for a bit to take all of the data collection skills that Garrett has over to giving you the best election coverage that we could. What was that?
This small thing going on in early November.
Just this little tiny thing that took all of our time, 24/7, even when we're at home and our family's like, we're here, we're still tracking the numbers. So we're back with you each day. We'll be back with you tomorrow. So Micah, I know you join us on here often, and as always, we appreciate it. We will be back with you tomorrow. Kristen's writing, yay, I'm glad you're back. We're happy to be back. Tina, thank you. You're welcome too. We just feel a sense of duty to keep you updated, especially at this time when it's increasing so quickly around town. So as we kind of wrap things up, Garrett, someone posted just a minute ago, Lisa was asking Halloween party results, ? And to her question, could we be seeing these numbers this quickly from Halloween weekend? So we're on November 12th, Halloween, obviously, on the 31st. This could definitely be the uptick from looser.
I'm not going to speculate as to what is causing what. I think that's a very difficult road to go down, because one of the things that's difficult with a virus like this is to sort of pinpoint the transmission and what's happening. But this is technically in the range of time that if we saw increases from Halloween, we would be seeing them right now.
Yeah.
The tests would be coming out and we would be seeing them. So that is something to just take into consideration, that, while no one can sit there and tell you, oh, this is exactly because of Halloween, we can tell you that we are within that time frame, that if Halloween were to do something, it's going to go. Similar to if we're, when we're 2 weeks out of Thanksgiving, we'll be able to tell Thanksgiving if there's a mass increase. We're like, well, I mean, we're within 2 weeks of Thanksgiving, and similar to any sort of holiday or any sort of gathering, you can sort of point to cases.
So that's one of the big concerns, is everybody being safe over the Thanksgiving holiday. We're hearing from some folks who are saying they're heading out to shop before Thanksgiving, and they're seeing product limits start to show up on items. So two sets of toilet paper, 2 sets of paper towels, napkins, things like that might start to see limits on them, and we're kind of hearing about that now. So just socially, that's kind of where we're at in this fight to keep everybody safe. So we are out of time for today. I know we cranked through a lot because we haven't been back with you guys since last Friday. So we will be here tomorrow. We'll have a lot more to get through, a lot more to talk about. We want you to stay safe in the meantime. We want to let you know where you can find us. If you have other questions and you send them to us, we'll try to get to those tomorrow or throughout next week. So for the very latest coronavirus reporting. You can find that on our website right now, abc15.com/coronavirus. We've also got a schools dashboard there that's got some updated numbers on it, and we'll try to keep you updated on some of the closures that we just highlighted. For those of you joining us late so far, Casa Grande Elementary School District, Creighton School District, and also Glendale High School shutting down until January. And Flagstaff, Steve is hollering over to me. Flagstaff is staying remote too through January, Steve? Through January. So this is how quickly this is changing here in the newsroom, how the updates are coming in, and we expect to see this throughout the day. So you're going to want to stay in close communication with your school districts, to your TVs, as we update you here, and also on our website. You can find Garrett on Twitter at Garrett_Archer. A little bit less election reporting now, although anything he tweets right now goes instantly viral globally because so many people were interested in election results, not only here in the United States, but in Arizona as well. So it is a hot Twitter account right now. My gosh. So that's where you can find him. I am on Twitter at Katie Rammel. That's where you can find mine. If Facebook, so many of you are watching us from there, is your preferred method, I'm on facebook.com/news from Katie. We keep the conversation going there too. So all that to say, we're so happy to be back with you every day. Send us your questions. We'll try to keep you updated throughout the week, and we'll see you back here, same time, same place tomorrow. Be